Hi, my name is Tanya Waycaster, and going over the reflective blog for Module 5. The subject is communication, delegation, motivation, and emotional intelligence. All these skills are necessary to manage a team, especially an interdisciplinary team. I work with hospice, so interdisciplinary team is our core of what we do. We have a team of social workers, chaplains, nurses, nursing assistants, and volunteers that we all coordinate care with our each other so that we can provide care for our patients. Reflections on my emotional intelligence. On the first test, I scored a 13 of 20. On the second test, I scored 77 out of 100, which shows I'm an optimistic and positive person. And test 3, I scored a 56, which equals great. I feel like I can read a room pretty good, and I can sense when someone is having a bad day or maybe upset and trying not to show it. I'm able to pick up on those things fairly easy. The thing about delegation is this is something I've struggled with. I do have a nurse that works with me that is my replacement when I'm out as the clinical manager, and seeing him in action and seeing him take charge when I'm there and I'm having a stressful day or just when I'm needing extra help has been very helpful to me. He gives me motivation and shows me that I don't have to carry the whole load on my shoulders, that he can be there to help support me in those ways. These are things that I have grown as a manager over 5 years and able to say that helps me. My strengths that I have found about myself are that I have good communication skills and I have good rapport with the staff that I work with and also the families and patients that I work with. I have a good rapport with upper management and leadership in our health system. The weakness that I sometimes do try to carry the load, especially if everybody's busy. I don't want to give them anything else. I would rather manage it myself. That I see that as a weakness, although I have started delegating more, as I had a health scare not too long ago with some cardiac issues, and one of the things the cardiologist told me was to start delegating and reducing the stress level of my job. So those are some of the things that I have done to do that. I think communication is the key on all levels, whether it's working one-on-one, working with a group, or leading a group. Especially in healthcare, communication has to be one of the top priorities on all levels, from the smallest things to the largest things. It has to be communication. So I hope that's it. Have a good evening.